Assalamu alaikum. Good morning, everybody. Today we will discuss a new lecture and very important topic about an anxiety disorder. I am Professor Muhammad Al Hadidi, Professor of Psychiatry, Mansoura University, and we are going to discuss together an anxiety disorder. This is ILOs of this presentation. First, normal versus abnormal anxiety. General aspect for an anxiety disorder, various type of anxiety disorders. Could we have a life? It's a very important question. Could we have a life free from anxiety? Life free from anxiety, I think it is not present in reality. Why? Because anxiety is a very essential part for our life. Sometimes it is disease and sometimes it is adaptive or normal anxiety. So we have what is called normal anxiety versus an anxiety disorder. Anxiety which can be normal. Why? Yes, anxiety can be normal or adaptive. It is important part for our survival. It helps us to escape from danger, from any dangerous situation. Even this situation may be exam. So you have an anxiety, so making you feel dangerous. So you have to study much more, or to avoid a dangerous object or a dangerous animals, and so on. And so an anxiety is adaptive that help you to avoid this danger. Medium amount of anxiety can improve performance in many tasks in your life. So how we can differentiate anxiety, which is normal anxiety or adaptive anxiety, from anxiety disorder? First, for normal anxiety, it is a normal reaction to stressful condition or difficult times. If you face a difficult times, you have to feel anxiety. Usually it is triggered by specific stressor and it is limited to this stressor. Once the stressor will be eliminated, the anxiety will be get off. It has a start and has an end. Yes, start and the end is related with the presence of the stressor. It can be helpful or motivational that help you to avoid this anxiety, lessen significant or disappear away from the situation and stressful situation. Relaxation only can be helpful and give you feel better, and a response to toxic situation can be come by making relaxation or gain by distraction. On the other hand, an anxiety disorder, it usually come out of nothing. It means that there is no cause or no specific stressful conditions that make you to feel anxious. Usually it is very intense and it is very disproportionate to amount of emotional response. So if you have even mild stressful condition but your response is too much than this, it is leading to an anxiety disorder. It may be last for long period, for weeks, for months, sometimes if not treated, maybe year. It interfere with your daily life. You cannot doing your work, your job, social relation, and so on. It have physical symptoms like sweating, trembling, lightheadedness, and racing heart. Feel impossible to control or cannot manage and need to be treated. So an anxiety disorder, the most important part for an anxiety disorder that it occur out of proportion of circumstance or the situation or the stress. An anxiety disorder is a very common disorder. It is representative the most common psychiatric disorder worldwide. In United States, we have about 40 million adults have an anxiety disorder. 31 million of average age in adulthood and age onset of adulthood, and 11 million people usually an anxiety disorder with younger age, even in childhood. About 1/3 of these people who have an anxiety disorder not seeking for medication and not treated, and they come or they pass without medication, and it is very bad thing. About 56% of people who have an anxiety disorder, usually this anxiety interfere with their daily life and work performance, leading to many problem, economical and work drops. An anxiety disorder is usually more common in women than men. About 60% are in women than 40% on men. An anxiety disorder is abnormal state in which the most striking feature are mental and physical symptoms, which are not caused by organic or another psychiatric disorder. So, for to be clarified or to be more simplified, we have a common anxiety symptom, and this common anxiety symptom we will discuss later. It could be physical and psychological symptom. If this symptom occur without any cause, it is called generalized anxiety disorder. If this symptom occur only if the person faces specific situation, it is called phobia. If this symptom occur only if the person in place and difficult to escape from, it is called agoraphobia. If this symptom is present only with false idea that cannot stop in our brain and know that it is false and I cannot stop, it is called obsessive compulsive disorder. So, according to DSM-5 criteria, American Diagnostic and Statistical Manual of Psychiatric Disorder, we have different type of anxiety disorder. First is specific phobia, panic, agoraphobia, selective mutism, separation anxiety disorder, generalized anxiety disorder, unspecific anxiety disorder, other specific anxiety disorder, social anxiety disorder or social phobia, anxiety disorder due to another medical condition, and substance-induced and medical-induced anxiety disorder. Anxiety disorder, as I say, it is very common and the condition is very common. This is the proportion or number of people in millions in United States. As you see, generalized anxiety represents 4 million people, obsessive compulsive disorder 3.3 million people, panic disorder and post-traumatic disorder we have 5.2 million people. Social anxiety disorder is very common also, and specific phobia is very common. So, what is the general anxiety disorder? General anxiety disorder is the first type of anxiety disorder which is characterized by the main or the core symptom of anxiety disorder, but these anxiety symptoms are present without any obvious cause. So, it is not related to situation, not related to condition, not related to specific idea or thinking in the brain. It is just symptom out of blue. It is like person is anxious without any cause or anxious from everything in his life. So it is called generalized anxiety disorder because people here are anxious from everything in his life. So we have psychological symptoms and physical symptoms. Psychological symptoms include fear, irritability, sensitive to noise, restlessness, poor concentration, worry thoughts, inability to relax and tense, while the physical symptoms include dry mouth, difficulty in swallowing, epigastric discomfort, loose motion, over-breathing, frequent urination and palpitation, difficulty breathing, failure of erection, amenorrhea, headache, and sweating. All these symptoms could be present on all types of anxiety disorder, but in generalized anxiety disorder, this symptom is usually not related to any other specific symptoms or specific situations. So it is called generalized because it's related to every time and occur every time in life. Like here is this diagram showing the physical symptom of anxiety disorder: sweating, chest pain, tremors, dizziness, decreased sexual drive, increased muscle tension, palpitation, breathing difficulty, heart palpitation, and increased blood pressure, numbness, nausea, vomiting, and weakness. Psychological symptoms include restlessness, easily fatigability, excessive worry, and anxiety, impaired concentration, irritability, and difficult to sleep. What is the cause for this generalized anxiety disorder? Usually it is hereditary, it is genetic predisposition, it runs in family with anxiety disorder. Also, there is chemical transmitter or chemical change in the brain responsible like GABA neurotransmitter, which is responsible for anxiety. Also, serotonergic receptor is abnormality. Social influence, sometimes people learn this anxiety from the condition, from social condition outside life factors or life stressor and family background. Prognosis may be persistent for years if it is not treated, or poor prognosis can be associated with hysteria, severe symptom, syncope, or suicidal ideation. To treat this generalized anxiety disorder, we have three options. First is medication, and the medication include benzodiazepine and antidepressant, psychotherapy, and it will be discussed later, and self-help groups with groups to share the same disease and help it together. For medication on medical treatment, benzodiazepine antidepressant. Benzodiazepine is very rapidly effective and it can give improvement in a rapid period, but it should be used only for short period because it have a risk for dependence. Also, it have been a problem with the decreased cognitive function, so it affects in memory and concentration. Antidepressant is also better to be used because less risk factor. Psychological factors, so psychological therapy, you have to help the patient to be actually stressed with the actual threatening condition, not with imaginary threatening condition. Cognitive behavior therapy could be effective. Usually it cannot be effective as a short-term medication, but it is effective on long-term use. So it is better to use both or to combine both together, which is medication and psychotherapy. Medication work on short term and psychotherapy for effective than in long term. The second type of anxiety disorder is phobic anxiety disorder. It occurs in particular situation, and patient, because for phobia he start to use what is avoidance or to avoid the situation that induce the anxiety disorder. Recognition that fear is unreasonable, but he cannot stop this. We have simple phobia or specific phobia. We have also social phobia and agoraphobia. These are the three types of phobic disorder. Simple phobia or specific phobia, it is phobia of certain situation. It can be situation, can be natural environment, can be animal. Situation like planes, aeroplane, elevator, closed place, or natural situation environment like heights, storm, water, animals, insects, and so on. Sometimes we have dental phobia, fear of going to doctor, dentist, and phobia of flying, phobia of illness. Its prevalence is very common in female more than male. The four major specific phobia category in natural environment, like hydrophobia, fear from water, and astrophobia in animal, according to different type of animal situations and medical situation. We have many names for phobias. If you would like to know some of them, it's welcome. If not, it is no problem. Specific phobia followed by social phobia. Social phobia is a situation in which person is feared to be present in social situation. And in this social situation, the person is observed and fear to be observed and be criticizing. So he fears that people, when seeing him, say that you're making faults, you speak in a hesitating way. Sometimes his face become flushed or trembling, and so people avoid to be present in this situation in form called avoidance situation, to avoid being facing or being criticizing by people. And so we have this type of phobia, which called social phobia, and these people usually avoiding being in social situation. Sometimes people try to treat themselves by using drugs like alcohol to decrease this phobia, and this is very bad or very hazardous condition. There is some specific types of social phobia, which called phobia of excretion or phobia of vomiting in public place. So people usually may be hindered to be placed or sit in beside the WC because they fear that they may get excretion at any time. As you see here, as this child is standing in front of his colleague, but he cannot facing him and he cannot answer a question directly to him because he have phobia. Also, if being in crowded place, they may be manifestation for an anxiety and she cannot share with people in social situation and being why? Because she have some symptoms. Usually she has muscle tension and muscle pain, lump in the throat because she cannot speak, flushing or sweating, shaking, heart racing, and nausea and dyspnea and avoidance. So she avoid to be in this situation and she's searching for the way to be escaping from this situation. The cause of social phobia or social anxiety disorder is genetic causes, which is hereditary. Sometimes it is learned by seeing other people who have social phobia and learn it from observation of them. The child maybe observe his parent who have social phobia, how he react in social situation, and he imitates this way and he continue doing this way. Early traumatic events in front of his friend, or for example, parental styling, isolated upbringing. So during his childhood, he don't have friends, he don't have to go outside home, and so he become social isolated. As you know, the same brain structure, there is chemical changes in which there is neurotransmitter changes, which is serotonin and GABA and norepinephrine. All these neurotransmitters play roles in anxiety disorder and social expectation. Agoraphobia is a third type of disorder. It is about 2 to 4% of the people. Anxiety in a crowded, open place, bus, supermarket. In being in the place, it is difficult to escape from. Any situation in which there is being in the place which there is difficult to escape from, and these places or this situation making the people to be housebounded, those wife, and it can be anxious and precipitated. It could be this agoraphobia increased till it make as panic attack or may lead to personalization and depression. It is very common in women in 20 and especially in occur suddenly. Agoraphobia, usually as I say, it is a type of anxiety that covers the diversity of category of fears that all based on the need to escape from a situation. Need to escape situation. If you present in certain place that is difficult to escape from, like leaving home or in crowded place or standing in line so you cannot get out of the line, or in closed places which is difficult in public transportation and so on. Treatment of phobia, the most important treatment, which is exposure. Exposure is the most important because people with phobia is usually use avoidance situation, and avoidance increase the condition and fix the condition. But if we make exposure, and what is called exposure and response prevention, which make the people to expose to the situations that making him anxious during doing some relaxation technique which prevents this stress. So exposure is the most important part, and one is especially always exposure and response prevention. Like here you can make exposure actually, and it can be doing step by step or can be imaginative, like in virtual reality using camera on virtual camera. So I can make exposure to the patient for situation like being in plane or seeing cat or seeing something and doing this exposure. Sometimes we make systemic desensitization. It means like we exposure little by little, and gradually increasing the stimulus or the stressful condition while doing and relaxing condition, so preventing to be an anxiety to be increased. It is very common to be used with phobic disorder. Obsessive compulsive disorder, and it is very common disorder also in children. In United States, we have 1 in every 200 children have OCD, and 1 or 3% of people in US, generally in adult, have OCD. OCD is mainly composed of two main parts or two main symptoms, which is obsession and compulsion. Obsessive compulsive disorder, obsession could be contamination, losing control, harming someone, or losing important item. Compulsion is washing and cleaning, orderliness, checking, double checking, and follow restrict routine. What is the difference between obsession and compulsion? Obsession is usually a thought or image. It is a thought or image, while compulsion is act or behavior. So in both there are recurrent, irrational, recurrent and irrational. Obsession is recurrent and irrational, and compulsion also is a recurrent and irrational. But obsession is idea, just thinking, okay? But compulsion is action and behavior. Sometimes obsession could lead to compulsion, so thinking could lead to action. And sometimes it is very anxious with obsession, and making obsession too much anxious need to be doing compulsion to decrease this anxiety. So sometimes compulsion decreasing the anxiety caused by compulsion. For this cycle, as you see, we have obsession, which is undesired and irrational thoughts. This making the people become anxious, irritable, and feel every anxious symptom we said before. So he doing irrational behavior or act to decrease this anxiety. Once he doing this irrational act, the anxiety become relieved temporarily till few minutes, then obsession came again, and anxieties become more again, and compulsion go, and this is cycle of OCD. What is the cause of OCD? The three main causes is genetic or hereditary, brain structure, as we say, we have brain areas and the neurotransmitter changes, and environmental, like experience physical, sexual, emotional abuse at young age. If we see this picture, we have found here 4 areas of the brain responsible for OCD or obsessive compulsive symptom. One of these orbitofrontal cortex, which is normally integrated the sensory information and the making decision and anticipate reward and punishment, and this area is defective in OCD. Basal ganglia, which is normally responsible for movement and tick and judgment, and this area when become defective, it leading to cause repetitive behaviors. Caudate nucleus, which normally responsible for processing and filtering of information, removing unwanted thoughts, which is irrational or bad thoughts, and this area is defective in OCD. He cannot remove these irrational thoughts. Cingulate gyrus, which normally added emotional response to thoughts, and if this is defective, it giving usually add disgust and disgusting and guilt feeling to thought of emotion. As we say, we have subtypes: contamination obsession with cleaning compulsion, hoarding, symmetry obsession or ordering obsession, obsession with visible compulsion, harm obsession and checking compulsion, and so on. Some we have to differentiate between obsessive behavior, obsessive compulsive disorder behavior, and normal behavior. For example, a man who is washing his hand 100 times before doing or before eating, it is 100 times till his hand become red or rose, is obsessive compulsive disorder. In comparison to woman, which usually washing her hand before every meal, or man who washing his hand before every meal, which is healthy pattern. Also, a woman who shaking, looking or re-looking the door of the home of the house for an hour or more than an hour every day before she going out is obsessive compulsive disorder. In comparison to a woman who double check only about the door of the home when she going out to be sure that the door is closed. So maybe doing normal or repeating one time it can be okay, but repeating more time it will be not okay. Sometimes OCD patient is presented to other specialty, not for psychiatrists. Dermatologists usually seeing the patient with cramped hand, with ecchymosis hand, and with hand from using hand and washing hand several times, it can be red and can be wound. interest or medical interest, we can fear patient came to him for fear of being HIV or AIDS, and he don't have any symptoms for this, for explaining of this. Dentist, he can come for dental gum. Pediatrician parent, sometimes patient came and bring his child to doctor for because he have an idea about that patient is having many syndromes or many illness or afraid about obsessive symptom about their child illness. Sometimes OCD can be as a result in pediatric to rheumatology, rheumatic fever like Sheehan, Chorea, and Pandas syndrome. Psychological treatment, as we say before, exposure and response prevention is very important and a very successful way. Also, facilitation of reality testing is effective. Treatment by drugs, SSRIs and clomipramine, which are the tricyclic antidepressant, and SSRI is very important and very effective treatment, adding neuroleptic in sometimes like in Tourette syndrome, and in very resistant cases which are not responding to antidepressant or antipsychotic, psychosurgery can be used in very limited cases. Panic disorder is one of the more common or very common, and you can face this in many situations. Recurrent panic attack or in unexpected situation. In this condition, we have very severe anxious and irritability, rapid and regular pulse, shortening of breathing, chest pain, sweating, feeling detached from onset, feeling detached from one's surrounding, nausea, fainting, dyspnea, trembling, choking, fear of dying, and fear of losing control. As you see here, hyperventilation, palpitation, heart palpitation, nausea, chills, sweating, trembling, numbness, and tingling. It is similar to heart attack, so you have to differentiate this from heart attack. The most important for differentiation is to making investigation and to examine the heart if there is condition present or no. If you're doing and your investigation and find that there is no any organic causes for this attack, it must be a panic attack. It's usually present with sudden onset in heart attack, sudden onset usually radiating to shoulder, have classic presentation, but in panic attack usually occur even during rest and sometimes during sleeping. If the person is stimulated or facing an stimulus, he perceived threat, apprehension, body sensation, interpreted this as having catastrophic condition, so he feeling the threat is much more, apprehension again, body sensation will be increased until he have panic attack. So you have to calming the patient and informing him that although you're feeling this sensation, but this sensation is not so serious, so you have to be calm more, and so he can avoid the increase of the anxiety symptom. Medical treatment of panic disorder, antidepressants are the first drug of choice. SSRIs, fluoxetine, paroxetine, sertraline, can be increasing levels of serotonin. Tricyclics like clomipramine, imipramine also improved by improving by increasing serotonin. It taken 4 weeks and it is very effective. SSRI is a drug of choice. Benzodiazepine giving rapid response and good effect, and it is very effective and work quickly, but the problem is addiction and cognitive function dysfunction. And so you have to be the big problem with medications that many people relapse when they stop the drug, so they have to continue the drug with making exposure, which is psychological treatment, and this psychological treatment exposure to external cues or internal cues and cognitive reconstruction, all this can help the people to be more improvement with treatment of panic attack with psychological therapy. So the most important is to make combination between medical treatment and psychological treatment, because medical treatment combined with psychological treatment help you to give rapid response and prolonged effect and decrease the relapse after the stopping of the medication. Take home message from this lecture: anxiety disorder is the most common psychiatric disorder. There are many types of anxiety disorder, all shared nearly the same etiological factor, symptoms, and treatment with few difference between them. We have to know all of them. Thank you and goodbye and good luck.